Let's start by exploring what cancer really is. We're taking a look at uncontrolled cell growth. Cancer is a word that carries a lot of weight. Many people fear it, but understanding it is the first step toward managing that fear. In simple terms, cancer begins when cells in a part of the body start to grow out of control. Our bodies are made up of trillions of cells. Normally, these cells grow and divide to form new cells as the body needs them. When cells grow old or become damaged, they die, and new cells take their place. This is a very orderly process. Cancer disrupts this order. It's like a car with a stuck accelerator pedal. The cells just keep going and going without stopping when they should. From a medical perspective, this process involves our DNA. DNA is the instruction manual inside every cell, telling it how to behave. Sometimes this DNA gets damaged, a process known as a mutation. These mutations can alter the instructions for cell growth and division. Instead of dying off as they should, these abnormal cells continue to multiply. They form a mass of tissue called a tumor. Some tumors are benign, meaning they are not cancerous and won't spread. But other tumors are malignant. This means they are cancerous and can invade nearby tissues and spread to other parts of the body. This is a critical distinction in diagnosis. The spread of cancer is a process called metastasis. This is what makes cancer so dangerous. Malignant cells can break away from the original tumor. They can travel through the bloodstream or the lymphatic system. The lymphatic system is a network of vessels and nodes that helps our body fight infection. When cancer cells travel through these systems, they can form new tumors in different organs. For example, breast cancer that spreads to the lungs has metastasized. The new tumor in the lung is made up of breast cancer cells, not lung cancer cells. Understanding this helps doctors plan the right treatment. So, at its core, cancer is a disease of our own cells. It is not a foreign invader like a virus or bacteria. It is our own body's cells that have forgotten how to follow the rules. This fundamental betrayal of the body's natural order is what makes the disease so complex. The goal of medical science is to find ways to stop this uncontrolled growth. We want to either remove these rebellious cells or destroy them. We also want to prevent them from ever starting their chaotic journey in the first place. This is where research, prevention, and treatment all come together. Now, let's talk about the many faces of cancer, focusing on common types and their signs. There are actually more than 100 different types of cancer. They are usually named for the organs or tissues where they begin. For example, cancer that starts in the lungs is called lung cancer. One of the most common types is breast cancer. It often begins in the ducts or lobules of the breast. A key symptom is a new lump or mass in the breast, though not all lumps are cancerous. Other signs can include swelling of all or part of a breast, skin irritation, or nipple pain. Regular self-exams and mammograms are crucial for early detection, which significantly improves outcomes for patients. Another prevalent form is lung cancer. It is the leading cause of cancer death for both men and women. The primary risk factor is smoking. Early-stage lung cancer often has no symptoms. As it progresses, symptoms may include a persistent cough, chest pain, shortness of breath, or coughing up blood. Colon cancer, or colorectal cancer, starts in the large intestine. It often begins as small, non-cancerous clumps of cells called polyps. Over time, some of these polyps can become cancerous. Symptoms include a change in bowel habits, rectal bleeding, and abdominal discomfort. Screenings like colonoscopies can find and remove polyps before they turn into cancer. Blood cancers, like leukemia, are different. They do not typically form solid tumors. Leukemia is a cancer of the body's blood-forming tissues, including the bone marrow and the lymphatic system. It leads to the overproduction of abnormal white blood cells. These abnormal cells are not able to fight infection properly. They also impair the bone marrow's ability to produce red blood cells and platelets. Common symptoms include fatigue, weakness, frequent infections, easy bruising or bleeding, and weight loss. The treatment for leukemia is very different from that for solid tumors. It is important to remember that many cancer symptoms can also be caused by less serious conditions. However, you should not ignore them. Common warning signs that should prompt a visit to the doctor include unexplained weight loss, persistent fatigue, unusual bleeding or discharge, a sore that does not heal, or a nagging cough. Paying attention to your body and noticing any persistent changes is key. Early diagnosis is one of the most powerful tools we have in the fight against cancer. It often leads to more effective treatment and a better chance of survival. While we don't have a guaranteed way to prevent all cancers, we know that certain lifestyle choices can significantly lower your risk. This is what we call risk reduction, or chemoprevention in some cases. It's about taking proactive steps to protect your health. Perhaps the single most important thing you can do is avoid tobacco. Smoking is linked to numerous cancers, including those of the lung, mouth, throat, bladder, and pancreas. There is no safe level of tobacco use. Quitting smoking at any age can greatly reduce your risk of developing cancer and other diseases. Your diet and physical activity also play a huge role. Maintaining a healthy weight is crucial. Obesity is a known risk factor for several types of cancer, including breast, colon, and kidney cancer. A diet rich in fruits, vegetables, and whole grains can help. Try to limit your intake of processed meats and red meat, since these foods have been linked to an increased risk of colon cancer. Regular physical activity not only helps you maintain a healthy weight, but also may lower your risk of various cancers on its own. Aim for at least 30 minutes of moderate exercise most days of the week. Protecting your skin from the sun is another essential prevention strategy. Skin cancer is one of the most common types of cancer, and it is also one of the most preventable. Excessive exposure to ultraviolet radiation from the sun or tanning beds causes most skin cancers. You should use a broad-spectrum sunscreen with an SPF of at least 30. Wear protective clothing like long-sleeved shirts and hats when you are outdoors. It is also wise to seek shade during the middle of the day, when the sun's rays are strongest. Regular skin checks can help you spot any new or changing moles early. Finally, regular medical care is a cornerstone of prevention. This includes getting recommended cancer screenings, such as mammograms, Pap tests, and colonoscopies. These tests can detect cancer early, sometimes even before symptoms develop, when it is most treatable. Vaccinations can also help prevent certain cancers. The human papillomavirus vaccine helps prevent most cervical cancers and several other kinds of cancer. The hepatitis B vaccine can help lower the risk of liver cancer. Making these preventive measures a part of your routine is an investment in your long-term health and well-being. When cancer is diagnosed, a team of doctors will work to create a treatment plan. The plan depends on the type of cancer, its stage, and the patient's overall health. The main goals of treatment are to cure the cancer, shrink it, or stop it from spreading. The three most common treatments are surgery, radiation therapy, and chemotherapy. Surgery is often the first line of attack for solid tumors. The goal is to physically remove the cancerous mass. A surgeon may perform a biopsy to diagnose the cancer, and then a larger operation to remove the tumor and some surrounding healthy tissue to ensure all cancer cells are gone. Chemotherapy is a systemic treatment, meaning it affects the entire body. It uses powerful drugs to kill fast-growing cells, which includes cancer cells. These drugs can be given intravenously or in pill form. Because chemotherapy targets all fast-growing cells, it can also damage healthy cells, like those in the hair follicles, mouth, and digestive tract. This is why side effects like hair loss, mouth sores, and nausea are common. Doctors work hard to manage these side effects to improve the patient's quality of life during treatment. It remains a cornerstone of cancer therapy for many. Radiation therapy or radiotherapy uses high-energy particles or waves, such as X-rays, to destroy or damage cancer cells. This treatment is localized, meaning it targets a specific area of the body. It damages the DNA of cancer cells, preventing them from growing and dividing. It can be used alone or in combination with surgery and chemotherapy. For instance, it might be used to shrink a tumor before surgery or to kill any remaining cancer cells after surgery. Like chemotherapy, it can also damage nearby healthy cells, leading to side effects like skin changes and fatigue. In recent years, we have seen the rise of newer, more targeted treatments. Targeted therapy uses drugs that focus on specific molecules involved in cancer growth. Immunotherapy is another exciting field. It harnesses the power of the body's own immune system to fight cancer. These treatments are often more precise and can have fewer side effects than traditional chemotherapy. The field of oncology is constantly evolving. If you or a loved one are experiencing symptoms that concern you, please do not wait. It is essential to consult a doctor for a proper diagnosis and to discuss your options. Early and expert medical attention is your best ally.